Welcome to Live Well. We're so happy that you joined us this afternoon. We will be talking about breast cancer awareness and how you can detect, check, and make sure that you are taking care of your body the best way possible. Our speaker today is Dr. Karlene Sinclair, and she's going to share with us information, valuable information about how we can best care for our breasts and have good breast health. Our goal in this program is to make sure that you're informed so that you can take the steps towards living well. I do want to give you a disclaimer though. This is for educational purposes only. So if there's some very specific questions that you have, you may want to address those with your physician, but I would encourage you to get a piece of paper and a pen or take some notes throughout the conversation with Dr. Sinclair, because at the end, we will answer your questions. If you have questions, feel free to type them in the chat box, or when we open the mic, you'll be able to ask her at that time. So Dr. Sinclair, I want to just tell you a little bit about her so you'll know who's talking to you today. She was born in Kingston, Jamaica, and she was blessed to attend 3 Adventist colleges and the West and universities, West Indies College, now Northern Caribbean University, Andrews University, and Loma Linda School of Medicine. She is a board certified general surgeon. She practices in Claremont, Davenport, and surrounding areas. She is a general surgeon who specializes in the care of breast and also take care of breast diseases. She has had the privilege of taking several mission trips to the Caribbean and South America. Recently, she had a chance to go back to Jamaica on the Feed the Fight Against Breast Cancer mission trip. She loves the Lord and enjoys caring for her patients. She is grateful, thankful that God has allowed her to give hope to so many. She and her daughter Joanne are blessed to be members of the Mount Olive Seventh-day Adventist Church, where she serves in several departments. Welcome, Dr. Sinclair. We are so glad you're here today. We look forward to hearing what you have to say about breast cancer and how we can better care for our breasts. Welcome.
Thank you so much, Dr. Sankey. I would also like to acknowledge, I just noticed a colleague and former schoolmate of mine, Dr. Wendy Perot, that she's online. Hi, Wendy, it's good to see you. I haven't seen you in ages. And I'm just happy to see all of those who have decided to join us. There she goes. You can give her a wave. And yeah, that's Dr. Pearl. And we're gonna go right into it so that I will speak. And if you have questions, like Dr. Sankey said, I want you to put it in the chat. If we haven't answered them in the talk, then I just want you to go ahead and at the end, it's my goal to answer as many questions as we can, okay? So the title that I have is Breast Cancer Facts versus Fiction. We live in an age where there are 2 terms that are just irk me: alternative facts, there's no such thing, and fake news. Those 2 terms, I just find the fact that we have accepted them and lived with them to be problematic. And not just in the political arena, but in so much of what's going on today, even as we battle this disease that's killing so many, that's part of the problem. So we're going to talk about what's fact and truth and what's made up, and how you can help decipher that to your benefit by the grace of God. Okay, here are some of the facts. It is the 2nd most common cancer in women. It's only behind skin cancers. About 1 in 8 women in a lifetime, that's up to about age 85, will develop. That's about 12% of women will develop some form of breast cancer. Some of the earlier forms are nothing but a nuisance. Some of the later forms, of course, can be more deadly. Breast cancers can and do occur in men. Even though men do not nurture children, all mammals, so scientifically speaking, we're all from that kingdom, the mammalian kingdom. Breasts are part of us. So men do have breasts. And as you can see, sometimes when you see a man who's very overweight, he actually can have breasts that are larger than some women that we know. That's because fat makes estrogen, and that's why that happens. But it doesn't have to be, that's not the case in terms of developing breast cancer, just the mere fact that you have breast. So about 1% of all breast cancers occur in men. It is very treatable with excellent results, not just okay results, with excellent results. If it's, and we're talking about with treatment, and I always have to emphasize with treatment, because sometimes when we present these facts, people think that, oh, well, then I can just wait. Well, no, as you will see in a little while, waiting is not good. So there are about just under 300,000 cases per year that are diagnosed. That's out of, these are US numbers. And you know, our population is about 330 million, somewhere around there. So that's the percentage of people who will be diagnosed with breast cancer. There's about just over 40,000 deaths per year. 17% of those who are diagnosed will die with breast cancer. And this is all comers. And we're going to talk a little bit about staging later, but this is for all patients with breast cancer, 17%. So you see already you do have, just by looking at mere statistics, you have a good chance of going on to live your life. It's not a reason for panic. It's not a reason for fear. 87% will go on to live out their lives after treatment. Now, I know those of you who are mathematically inclined are going to say, well, 17 from 100 and 87 from 100 is not the same number. I don't have time to explain the mathematics and statistics, but just rest assured that most patients, okay, over 80% are going to be okay if they're treated, diagnosed, and treated. Now, there are two risk factors. Two sets of risk factors. There are those that are unchangeable. It is what it is. And those that are changeable, meaning that we can do something to help ourselves in this way. The unchangeable risk, gender. Actually, this is the number one cause, the number one risk for breast cancer is being born female. And I say being born female because we know what's going on in society. I know they make it seem like it's prevalent. It's only a fraction of people who claim that they were born the wrong gender and they may do things to change it. But biologically being born a female puts you at risk, regardless of what you do to yourself later in life. Age, cancer, most cancers, and especially breast cancer, is a disease of the aged, meaning that as we get older, our risk increase. Family history of breast cancer. There is about 20% average increased risk if depending on the number of first-degree relatives. First-degree relatives are your mother, your sister, or multiple second-degree relatives, or your mother, sister, or daughter. Multiple second-degree relatives, like if your grandmother, multiple aunts, multiple cousins have breast cancer. That does increase about 20%. Now there's a gene risk. The most well-known gene is the Brca gene. If you test positive for this, you are going to get breast cancer. It's 95 to 98% breast and ovarian cancer, not just breast cancer. So there's a lot of discussion that has to be done with yourself, with your doctors, and in terms of monitoring, in terms of timing of surgeries, to remove the organs that are going to be affected before cancer can get into them. There are other genes that we have discovered that are not as consistent, but still show a higher risk in terms of development of breast cancer. And those patients have a higher than the routine 20% risk. So 80% of people who have breast cancer, especially those who develop breast cancer in their 80s and 70s, those ladies, the risk to their family members are actually a lot lower than, say, somebody who developed breast cancer in her 40s or 50s. Breast density. This is actually a finding on the mammogram. The way our breasts work is that when the reason we don't start mammograms at a certain age is because when we're younger, our breast tends to be dense. And we see that, right? you know what it is. You know what your breasts look like when you're in your teens and early 20s, as opposed to as we age. As we age, those ligaments get more elastic, and your breast becomes more fatty replaced. That is what's supposed to happen normally. We find that there's a group of women who maintain this density in their breasts. And this is just an observational finding where, you know, because breast cancer is one of the most researched things that's around when it comes to medicine. So when they look at thousands of mammograms, they realize that they look for things that are in common or not in common, and they have statistical things to see whether or not it's a coincidence. Well, those patients who have consistent dense breasts, even as they age, do have a higher risk. It's probably just a genetic thing that puts them at high risk, and it's manifested in the breast density. There's nothing that you can do about that. Now, here's the things that we can do something about. Obesity and high-fat diet increase your risk of breast cancer. Mentioned earlier about men who are overweight, and notice that they almost look, well, not almost, some of them actually do have breasts that are even bigger than some of women that you know, because estrogen is produced in fatty tissue as well as in the ovaries. But obesity and high-fat diet definitely increase risk. Of course, alcohol and tobacco, you know, tobacco is good for nothing. Tobacco is probably associated with every major disease, every form of death, high-risk death, including even COVID, because you know that the patients with lung problems are much more likely to have severe COVID and die from COVID than those who don't. So tobacco is basically good for nothing. Menopausal hormonal therapy. This was, I want to say in the late 70s, early 80s, where I'll back it up a little bit. The scientists noticed that women were at lower risk for heart disease than men, but after menopause, their risk for heart disease went up. So they came up with this great idea. Let's give women hormones so they continue to have hormones even after the time when they're supposed to stop menopause. That's what it is. And we gave people Premarin, which is really pregnant mirrors of urine. That's where they extracted the extra estrogen from. And over time, they found out that this hormonal therapy actually is detrimental. Not only did it not decrease the risk of heart disease was actually greater, but it also increased the risk of breast cancer. Radiation treatment. This is not an X-ray or a mammogram or even a CAT scan. As we know, some of us know young people who have been diagnosed with some sort of breast cancer, not some sort of cancer, like Hodgkin's lymphoma, non-Hodgkin's lymphoma, and other cancers like that, where they receive thyroid cancer, where they receive radiation treatment to the chest, and of course it involves the breast area. Those patients are at a higher risk for breast cancer. Usually it's an early form, very treatable if it does happen. It just increases their risk. Now, what can we do to decrease risk? By regular exercise and maintaining a healthy weight. I cannot overemphasize this enough. I cannot over-exaggerate it enough, as I am over-exaggerating and overemphasizing. Why? Because those two things are not only prudent in breast cancer, they're prudent in everything that causes us to die. When you look at the #1 killers in the country before COVID, it was heart disease, diabetes. Those were the things that were the #1 and 2 things that kill people, okay? And exercising and maintaining a healthy weight are the antidote to those 2 things. And when it comes to cancer, we found in breast cancer and also colon cancer, the obesity high-fat diet also goes to colon cancer as well as prostate cancer. Breast, prostate, and colon. Okay, the 3 most common cancers that we talk about. Those 2 things, the anti-one and the positive one, exercise, are the 2 biggest things that we can do for ourselves, just in general. Early pregnancy, what do I mean by this? I mean, most people are in menarche somewhere between 10 and 12. If you get pregnant in your 20s, those people have a lower risk than those people who wait until in their 30s. A lot especially over the recent decades, many women are not getting married or having children or whichever order they choose until in their 30s, some by circumstance and others by choice. We've found that the longer you stay from the time you start your menses to your first pregnancy, those women are at a slight increased risk of breast cancer. Breastfeeding actually decreases the risk of breast cancer. Who knew? So it actually decreases the risk of breast cancer. So that's something that if you are, many of us on the line are no longer in that category. I don't know everyone on the line, but I know from myself and some of the other ladies I know on the line, we're out of that. But of course, if we have children, nieces and grandchildren, or whoever in our influence, we should encourage them if they can to breastfeed. Okay, we're gonna spend a moment on fiction, aka fake news. Deodorants cause breast cancer. No, they don't. Deodorants do not cause breast cancer. It is always good to use natural products. There's nothing wrong with that. Some people need stronger than natural products, and there may be some problems with the aluminum or aluminum in deodorant, but they do not cause, there's no causative effect at all on breast cancer. Mammograms cause breast cancer. No, they don't. They're a diagnostic tool. They find breast cancer, but they don't cause breast cancer. Large breasts increase the risk of breast cancer. You'd think, right? If you have more breast tissue, more likely. No. They don't. The breast size does not affect it at all. Vegetarians cannot get breast cancer. And this myth is also going on with COVID, that if you're a vegetarian, you won't get COVID or you won't get sick from COVID. None of that is true. Being a vegetarian is a wonderful thing. But our health message is not a vegetarian message, it's a health message, which includes a plant-based diet. So there's many benefits. But even colon cancer, which is the one that was studied extensively with vegetarianism, yes, the rate of colon cancer in people who are lifelong vegetarians is way low, extremely low. When you match people age for age, race group for race group, environment where they live, if you're vegetarian as opposed to not, your risk of colon cancer is way lower. Being vegetarian is important. It helps us. Plant-based diet, it helps us live healthier lives. It helps us maintain our weight and prevent obesity, but it does not prevent breast cancer, okay? If it happens, being a vegetarian or being more vegetarian, going to raw, going to this, is not gonna change that. So be healthy, but these things do not cause or contribute to breast cancer. Here's a fact: mammogram saves lives. Why? Because we can detect something early. Cancer is, let me tell you what cancer is, and this is all cancers. Cancers are cells that are growing in our body on their own. All of our cells in our body are growing with each other. When the cells get to be a certain age, they start to die and new cells generate. That's the way our body works. It's a long word, it's called homeostasis. What happens with cancer cells is that they start growing on their own. And all the signals that the body are saying that, okay, it's time for you to die and let a new cell come, they don't do that. And not only that, then they start generating their own blood supply so that they keep growing. And they will continue to grow wherever they are until they take over your body and until they destroy the body, which is the host. They're like a parasite, okay? So when we find it early and we are able to rid it from the body, it's natural that you're going to live a long time because we have removed it and it has not taken root or spread anywhere. So that's what mammograms do for us. It allows us to detect it early. We're able to do biopsies early to determine, because not everything that's abnormal is cancer. And we're able to treat early. And when it comes to treating early, the treatment is usually less, the earlier it is, the less severe it is in general. and the outcomes are excellent. I want you to pay attention to the right side of the screen. Stage 0, this is called, the fancy term for it is carcinoma in situ, meaning the cancer is just in the lining of our ducts. Whether or not you have had children, you have those ducts prepared. They're prepared, they're with you when you're born, they develop as you grow, and they're there with you even after you've had children or whether or not you have had children. If the cancer is just in the lining of those ducts, you have 100% survival with treatment. If it's a very early cancer, stage 1, okay, we're talking up to a centimeter, okay? With treatment, we're talking 92% survival. Stage 2, which is anywhere from 10 to 20 centimeters, that's just under an inch in size. The survival drops off, but it's still fairly high, 85%. Now, this is one of the bigger drop-offs here. This is when the cancer leaves the breast and starts to go other parts of your body. The closest part is the lymph nodes. We have lymph nodes all over our body. They drain, they help fight bacteria and infection, and they help fight cancer. So once the cancer becomes established in the lymph nodes, you notice we're now down to 74%. Still fairly good, but much different from up there. This is our biggest drop off, and this is always the most unfortunate, because once the cancer now leaves the lymph nodes and goes to the liver, the bone, the brain, the lung, the survival drops down to almost a third. So that's why we do what we do and encourage women to do what they need to do to find it early, because we know that God has given us the ability to take care of this thing before it goes too late. If you think of someone, if you're in a major car accident and you're losing blood, if you get to the hospital early and the doctor is able to operate, stop whatever is bleeding, sew you up, you will survive. The longer it takes for you to get to that hospital, the more blood you have lost. Even if you get to the hospital and you're still alive, the chances of survival are so much less because your body has been starved from blood and oxygen for hours. Now, the trauma scenario, I was a trauma surgeon for 10 years, is a much more acute situation, right? You're in a car accident and you know the ambulance comes and so on, and everybody works together to get you better. In those situations, nobody questioned me. As a trauma surgeon for 10 years, nobody questioned me as to why I'm operating, why I'm spending 2-3 hours in the operating room with their family member, okay? But I can't tell you how many people question me when it comes to saving their lives just because this process is slower. You gotta remember, Satan said to Eve, "You shall not surely die." And both she and Adam lived almost a millennia, but they died. This is how we gotta look at breast cancer. It's like sin. It's not gonna, because it doesn't take you out so quickly, do not believe it's not gonna take you out, because it will, if we don't do what we know to do in order to be healed. The mammogram is our mainstay of diagnosis because we have found that it can detect cancers early. And as we saw on the previous slide, that is such a boon, being able to detect it early. Ultrasounds are more used to define the lesion, and we use it to do the biopsy, because now we have techniques, well, we have had them for several years now, a couple of decades at least, where we can use a specialized needle just to get a sample. Before, even when I was in training in the 80s, anybody who had a lump, we had to take them to the operating room, we had to take out part of their breast. A lot of these lesions were benign, because there are a lot of benign things in the breast. That's another reason for us not to panic. We're going to get to that later. So the ultrasound and the mammogram combination has allowed us to actually determine, even before we do anything, that some lesions we don't even have to worry about. And then others, we can just do a biopsy. There are other studies, MRIs, PET scans, that we do when we're doing more intensive surveillance or trying to diagnose patients. The mainstay of breast cancer treatment is surgery. There are different types of surgery, how much surgery you need, whether from a lumpectomy to lumpectomy, sentinel node biopsy, all the way to mastectomy. All of those things are going to depend on several factors, not just the fact that you have cancer. Radiation treatment does make a huge difference. In patients who get radiation treatment after surgery for when they've kept their breast, their chance of local recurrence is down to like less than 5%. Those who don't have radiation therapy, the chance of local recurrence goes way up. And I've had several, I've been here 18 years now. And unfortunately, I'm dealing right now and over recent weeks with several patients who I treated a few years ago, and they always had an excuse to not complete their therapy. And they're back. And now I have to do more surgery, because when you allow something like this to come back, it's not going to come back the way it was when it first came and it was early. It's always going to be more aggressive. And when you have partial treatment as opposed to no treatment, as opposed to full treatment. Nobody wants to have chemotherapy. I've had people come into my office, they said, well, I'll do radiation, but I won't do chemo. And I'll tell you what I tell them. You're not at Olive Garden. I'm not handing you a menu, okay? Whenever we look at all your studies, pathology report, and myself and the radiation oncologists, the medical oncologists get together and we say, this is the best course of treatment, it's not because we want to give you chemotherapy. We don't want to give you chemotherapy. We know what chemotherapy can do, but we also know that it saves millions of lives each year. And millions of people go on to their life and living their life once their treatment is over. It's not easy. Hormonal therapy, these are actually anti-estrogen. Some tumors are estrogen positive, progesterone positive, and we've found that hormonal therapy can be very effective. It can also be effective in some patients with abnormal findings that are not cancer. We find that this even though it says hormonal therapy, is actually a misnomer, because it's actually anti-hormone therapy that is able to actually prevent, when we treat people with these medicines and look at them in 5 years over the ones who are treated and those who are not, we found that those who are treated have a much lower rate of developing advanced cancer or recurrence than not. These things we go over it once we get all the diagnosis, all the results, and then the recommendations are made. I'm going to talk briefly about two different types of cancers, because they're not like the regular breast cancer. They both can be very deadly. And if you look at the bottom here, this one presents as stage 3 or 4, and this one presents as stage 3. And if you remember the earlier slide, that is when your survival starts to drop off. Inflammatory breast cancer looks like an infection. It looks like you have cellulitis, you have redness, orange, your skin looks like the skin of an orange, is hard. You can have draining sores. And yes, you could have had a normal mammogram a few months before. These are very aggressive. They're not following the script, so to speak. And we just need for you to be aware of it. If you have had a mammogram or if your breast exams have been normal, and then now this happens, it's not a reason to say, well, it's probably nothing. Let me take some antibiotics. Let me do that. No, you need to get checked out immediately, because and when we have patients with this, we know that we're coming out with the big guns, because it used to be, the inflammatory cancer used to be like a 6-month thing, literally. When I was in medical school, I had the opportunity to go to Sloan Kettering in New York, Memorial Sloan Kettering, the big cancer hospital, and do an elective there. And I remember patients coming in with inflammatory breast cancer, and I actually worked with one of the pioneers in breast cancer medicine, surgery. And I remember one lady, and she was talking about her son was going to graduate from school and so on. And I was there as a student. Of course, you study and stuff. And after she left the room, and Dr. Fisher is like, she's not going to make it. And this was the premier place where if you're going to have a chance, I said, now I have patients who have gone on 4, 5, 6 years with inflammatory cancer. It's not the same. One, because number one, we have diagnosed, even though it's a quick it's an advanced cancer. We're still diagnosing it quicker because what used to happen before, people would be treating an infection for months in their breasts, going to their doctor. Now that doesn't happen anymore. Most of the primary cares know that if they see this, they're going to send them to a surgeon immediately. And two, some of the advances we have made in chemotherapy and hormonal therapy has helped us help these patients so that they are living for years instead of months. Anaplastic. Ana from anarchy. Okay. Again, you have normal mammograms, etc. And this tumor just like, it's like a shotgun. It just comes out of nowhere. You look at the mammogram last year, there's nothing there. You know, yes, radiologists make mistakes, but I'm talking about you look at the mammogram last year, there is nothing there. And before the mammogram next year, you have a sizable tumor. Rapid growth is painless. One of the reasons why people keep cancer so long is because it's painless. I've had ladies in their 70s who have come to me who have had this for months, years, and not until it starts to ulcer and bleed. This is not anaplastic, it's regular breast cancer, that they finally come to us because it started to bleed. Okay, but anaplastic is, again, rapid growth. And here's a problem. It presents at stage 3. We're not sure why these cancers grow so fast, but they are. And if we do diagnose them, we are able to help patients and do a lot more than we used to be able to do. The surgery is more aggressive, the treatments are more aggressive, but patients do well, meaning, 5, even 10-year survival with some of these cancers, even though they present fairly late. So we're going to diagnose. What are we going to do? Mammogram, 85 to 95%. It's a man-made thing. It's not going to be perfect. And people are always jumping in. Well, I know somebody who had breast cancer and their mammogram was, yes, you're going to know somebody like that, especially younger people, because it's harder. Their mammograms are harder to read. The younger people, meaning in their 30s and 40s, yes. But it's still 85 to 95% is much better than 0%. Ultrasound to define masses. Ultrasound cannot take the place of mammogram. Trust me, we have been doing research. The Breast Cancer Society, other societies have been doing research for years. They developed these high-power ultrasounds, trying to see if they could detect breast cancer as well as a mammogram. It doesn't. So that a lot of that technology is still there. They're probably still working on it, but it's you can't substitute one for the other. MRI is used in select patients. Why? Because it can be a double-edged sword. It can see more things, some things than the mammogram, and some things that it's going to see is not going to be necessary. So that's why we only use it in select patients, high risk. And if you already have breast cancer, certain types of breast cancer, we will use it to make sure that there's not a cancer in the other breast. Biopsy is a definitive diagnosis. You have to get a sample of tissue. That's one of the areas where the past 20 years have been just excellent. Past 20, 25 years have been just excellent for patients, where we have been able to do a biopsy in our office. I do biopsies in my office. I have an ultrasound in my office. I give you some lidocaine, I numb it up. I find a lesion. I put a specialized needle in it. I get a sample. I send it off to the lab. It is very, very accurate. Very, very accurate. So you don't have to go to surgery and all that just to get a diagnosis, because there are a lot of things, especially in younger women, there are a lot of lumps that are not cancer. Surgery is the mainstay treatment. Some surgery is going to be necessary. Some procedure is going to be necessary. The type of surgery is going to depend on what's going on with you. Radiation therapy is used for breast cancer, prostate, colon, thyroid, several other cancers. Focused radiation, special ionizing radiation that kills cancer cells. It's used in conjunction. Again, it's part of the completion of therapy. Patients after surgery and radiation, then they're usually in one of these two categories: hormonal therapy or chemotherapy. This is determined when we do a sample. There's so many tests we do. There's some additional tests that I didn't even put on here, where we actually looking at the genetic makeup of your cancer to see whether or not you're going to benefit from chemotherapy or would you just benefit from hormonal therapy? So there's a slew of tests. Used to be, I would just say breast cancer, stage such, and that's done. Now, in addition to lymph nodes, I have mammoprint, I have grade, I have mitotic value. There's a lot of stuff that I have that I look at on a report, and that the other doctors who I work with are going to look at when we come up with a treatment plan. But the fact of the matter is, once that treatment plan is looked at and agreed with, it is up to us it's up to the patient to follow through. Because if you're partially treated, I can guarantee you that we're going to see you again, or somebody's going to see you again. And not that we don't want to see you again, but not for this. Now, I have to say something about fictional treatment. You notice I have a strike through with herbal and alternative medicine. I don't have a strike through with dietary. We're going to start with herbal medicines. Herbs are for the healing of the nation, and there are many things that herbs can do, okay? I'm going to tell you a story, and then we're going to continue with this. I was given a talk some time ago, and a young lady was in the audience. She was very overweight, and she said to me, Dr. Sinclair, diabetes, I was actually giving a talk on herbal medicine, which I do from time to time, because there's lots of things that you can benefit from taking herbs. And she said, diabetes is rampant in my family. And like I said, she was very overweight. I want you to tell me an herb that I can take that will prevent me from getting diabetes. That was her question. There is no herb that she can take that's going to prevent her from getting diabetes. Okay, she has a history, family history, and she's overweight. Going back to that slide that I talked about, obesity and high-fat diet. The herb that she needs is a lifestyle change in terms of what she's eating, how much she's exercising, whatever she's sleeping, in order to stay at a healthy weight. So herbal medicine, there are things that herbs can treat. There are many things, stomach problems that ginger and turmeric is great for arthritis. And there are many things that herb can treat, but herbs cannot treat cancer, okay? You have to think of cancer as a major car accident or being shot, okay? It doesn't matter how healthy you were before it happened. It doesn't matter it doesn't matter if you don't get treatment, you will not get to that next stage. Being healthy before is great, because we know when we do surgery on a healthy person, they do better. But herbs cannot cure breast cancer. Alternative medicine. People, my mother used to say, a drowning man catcheth at a straw. But what happens when a drowning man catcheth at a straw? He drowns, because a straw cannot sustain him. There's no alternative medicine that can cure breast cancer or colon or prostate cancer. There's none. So if you have breast cancer and you seek out these therapies, and the way to find out is that you let them tell you, I can, right now, if you come to me and you said, as happened recently, I called a friend of mine who has had stage 4 breast cancer. I found out a few years back when I went to my nephew's graduation. She was a friend of mine in Maryland, actually, and her hair had this auburn color. She's a light-skinned lady. And she was like, this is not a dye, this is the chemo. But she looked fantastic. I thought she had dyed her hair, to be honest with you. And that she has been living stage 4 now for, oh my goodness, when is it? CJ is now a doctor, finishes residency. So that was over 8 years ago, almost 8 years ago, and she was already 12 years into stage 4 disease. And so when I had someone else who I was taking care of, who had cancer, I called her and said, can I give you the number? And she spoke to her. And she was able to help her go through her treatment. I've had other people, instead of doing this, who decide that they're going to go to alternate medicine. I say that to say, when you come to me or somebody else like me, they should be able to point you to 2, 3, 4, 5, and I can, by God's grace, I can point you to dozens of women. Right now, I can get dozens of women on the phone that I can call and say, this person has breast cancer, can you talk with her? Because they have been treated and they have done well. And those are just the people that I'm close to. I have dozens more patients, and I'm just one doctor. When you go to alternative medicine, I can't tell anyone who can tell me somebody who they know went to this person who was actually healed. But yet still we do it. Even us who are supposed to believe in God do it. You notice I do not have a strike through on dietary changes. You know why? Because it's never a bad time to have a good diet, right, Dr. Cooper? It's never a bad time to have a healthy diet. It will not change the fact that you have breast cancer, but if you're healthier, it will help you go through your therapy. So I will not strike through dietary changes. It is not a treatment for breast cancer, but it is not a bad idea to try to live a healthier lifestyle, which is going to include some dietary changes. Okay? And I see that there's some questions in the chat, and I'll try to get to those in a moment. So what do we need to do? Healthy lifestyle, low-fat diet, routine exercise, adequate sleep. I can't emphasize these three enough. There are other things too, you know, the sunshine, the water, and all that kind of stuff. But these three are the main ones: that you eat well, you exercise regularly, and you get enough sleep. That is the sleeper, no pun intended, well, pun actually intended, when it comes to healthy lifestyle. You need enough sleep. I can't even start on that because that's a whole lecture in and of itself. Monthly breast exams, choose the same time each month. If you're still menstruated, do it about a week after your period and then continue. Yearly mammograms, starting somewhere between age 40 and 44. Yearly or bi-yearly, meaning every 2 years. I'm just going to put this in there. The new recommendations in terms of bi-yearly and so on, those recommendations were made with no surgeon and no oncologist on that committee. This is purely coming from the insurance companies who don't want to pay for the mammogram. So what they tell you now is that if you could a yearly or every 2 years, if you think it's necessary, you can do it yearly. That's age 40 to 44. From 50 to 75 should be yearly. And then from 75 on, bi-yearly. I have patients with breast cancer at both ends of the spectrum. My youngest patient ever that I ever took care of, age 24. My oldest patients I ever took care of, age 95. And the 95-year-old did not die from breast cancer. She died like most 95-year-olds. She fell and broke her hip. That's the biggest thing that killed older people. If you have a first degree or multiple second degree family members with breast cancer, you start earlier. You may have to start earlier. If they started developing cancer in their 40s, you need to start in your 30s. Yearly checkups, physicals, and pap smears, because that's another whole lecture too. As I said, my friend Dr. Perot is online, and that she could talk to you about that too in terms of life-saving. So you found a lump. Here are the do's and don'ts. Make an appointment to see a doctor. Get a mammogram or ultrasound. You may need a biopsy. You may need to get a second opinion. And the reason I cannot overemphasize the second opinion, I have had patients who have found a lump, who have had negative mammogram and ultrasound, who were told, oh, the mammogram ultrasound is negative. but the lump was there. And the medical professional who took care of them saw that the lump, but because they had a negative mammogram ultrasound, they did nothing about it. If you feel a lump, you need to see a surgeon, whether or not it's on the mammogram. And certainly if it's on a mammogram or ultrasound, you still need to see a surgeon, because you need to make sure that this is not anything to be concerned about, especially if you've been having normal mammograms and now it's there. What you don't do is don't panic, okay? Not everything that goes bump in the night is bad. Sometimes you just put something bad on the shelf and it fell. That's all it is. There's no robber in your house, okay? Do not worry. This is Jesus's thing. I'm just repeating what he said. Don't worry. Do not think it's gonna magically go away, okay? And I use the word magically for a specific reason, because when you see something is there and it stays there and you keep saying it's going to go away, I'm praying about it, you're beyond prayer. You're into magic now. Because we all know that we pray, Balaam prayed, eventually God told him to go, but is that what God wanted him to do? Okay. Do not start taking some herb that somebody told you about. Herbs are medicinal plants. Medicinal plants. I'm going to say it again. Medicinal plants. Herbs are medicinal plants. And like all medicines, you don't just randomly start taking something for what you think is a problem. If you're using an herbal solution, it should be something that you have some credible information that it can actually help you. And this is not just for breast cancer, this is for anything that might be going on with you, okay? Do not go on the internet to try to figure out what's going on, okay? Don't do that. Don't do that. Here are the good news. Early diagnosis, great prognosis. Survival rate is greatest when it's diagnosed early. Early diagnosis means less aggressive treatment with excellent results. Millions of women have been diagnosed with breast cancer, treated, and are living right now. Right now, we're not in a building, so I can't say, somebody next to you, but I can assure you that even you may not know her name or his name, because I have taken care of a few men as well, but there are people that you're encountering every day who have survived and they're living their life like it's golden with breast cancer, and they're not in a corner somewhere, woe is me. They are happy, healthy people living to see their children, grandchildren, and some of them even their great-grandchildren. Here are some trusted websites. Okay, I'm going to leave the screen up for a moment. If you want information about breast cancer, why? Because these websites are they're not trying to sell you anything, and they're giving you information that has been proven and tested, not just what somebody says. There is cancer.gov. This is a division of the National Institute of Health. They have, when you type in breast cancer, they have the patient version and the doctor version. The patient version, of course, is simplified, so whether or not you're a medical professional, you can get the information that you need. Breastcancer.org is actually developed with the American Society of Breast Surgeons, and it is a source for both medical professionals as well as patients. It goes over everything, including chemotherapy side effects, some of the stuff that you can do, natural stuff. Here's where natural medicine comes in really well. Some of the stuff that you can do to help you help restore your skin after therapy and all that. The Komen organization, Susan Komen is a survivor, and she has donated, her estate has donated millions of dollars into things, giving people free mammograms, treatment, and other things. Cancer.org is the American Cancer Society website. That's all cancers, including breast cancer. Also, just cancer.gov and cancer.org and breast cancer. Those three have information in multiple languages, including Spanish, Creole, and other languages. So if you have family, friends, associates who are non-English speaking, the same information is available in all. The Sisters Network, I actually met these ladies since I came to Florida, but they're all over. This is a group of Black women with breast cancer. They are a support group, and boy, do they support. They can match you with someone with similar age, even ethnic background, because despite what I tell you or the doctors tell you, sometimes some of the questions you have, you just need a lady who has gone through the experience. There's a support network, and they're also a resource for patients with breast cancer, okay? And I'm thankful that Dr. Sankey is recording this so that this information will still be available. Now, for those of you who are astute mathematicians, you notice that this says 83 as opposed to 87. It's really 87% in terms of people who are living now with breast cancer. It's not a death sentence. 83% is a high number, but these are people who are treated, okay? And here's the thing, God is in control, okay? There's nothing that happens in our lives that catches him unaware. Like he's like, oh my goodness, that happened to Karlene? No, okay? Nothing is out of his control. So when whatever it is that's going on in our life, the first thing we need to do is pray, but not the prayer like they prayed with Jeremiah. Remember, those of you, at the end of when Nebuchadnezzar came and he took the people away, but Jeremiah decided to stay, the people said to Jeremiah, this, you go and pray and everything the Lord said we will do. And when Jeremiah says, stay here, you'll be fine. Stay under the rule of the Nebuchadnezzar, whoever Nebuchadnezzar set up. They said, no, you're lying. We're going to Egypt. Not only did they disobey, but they took Jeremiah with them. That's the last we heard of Jeremiah. Okay? That's not the kind of prayer we need. We need someone, you need to pray, and you know that God knows the situation, but you need to pray about it with a willingness to allow him to lead and guide you, okay? Claim the promises. There's nothing, he said, my grace is sufficient for me, for thee. Do the right thing. The right thing is not pretending it's gonna go away. The right thing is not hiding it from family. The right thing is not saying, I rebuke it in Jesus' name. I'll tell you one quick story. I had a patient who came and she said, oh no, it's fine. I'm going to be done. I rebuke it. God is going to take this away from me. He's going to work a miracle. And I said, oh, that's interesting, because I'm a Christian and I didn't know I could demand that God work a miracle for me, especially when he has provided a way. I didn't know you could do that. I didn't know you could just say, God, this is what I want and you're going to do it. And it made her stop and think, because unfortunately, when it comes to breast cancer, people come to me with gallbladder disease. They want to have surgery last week. I tell them it's 2 weeks before their surgery. Can't you do surgery earlier? Because they're in pain. They come to me with breast cancer and they're arguing with me about whether or not they need this or that. When you pray and you claim the promises, you must do the right thing. Do what you would do if this were anything else. You would follow the instructions, you would research the information in a godly way, and you listen to God. My last words, trust. Trust in the Lord with all your heart and lean not to your own understanding. In all your ways acknowledge him and he will direct your paths. But that's what we have to do. We have to allow him to direct our paths. If anything that you would have done, if you went to the doctor because you were having a fever, if you went to the doctor because you were in pain, if you were in an accident, whatever you would have done in terms of what you're told by your doctors, when you have a lump in your breast or you have an abnormal mammogram, you need to have that same attitude, that you're ready to do whatever needs to be done in order to take care of yourself, because you're trusting that the same God that directed the doctor when he took care of your high blood pressure and diabetes is the same God that's going to direct the doctor who's going to care for you. I know the plans I have for you, says the Lord. Plans to prosper you, not to harm you. Plans to give you a future and a hope. God is in control. He knows the plans he has for us. And it is up to us to decide whether or not he works it out and the way he works it out in our lives. But if we already are going to determine that we are going to go any way we want because we have this thing and we're all up in arms, we will not give God a chance to work out the future and the hope that he has for us. And this is one of my favorite texts. You will keep him in perfect peace whose mind is stayed on thee because he trusts in you. Comes back to trust. God has promised us peace. He said we will have trouble, but we will have peace. We can't have this if we're determined to have our own way and not willing to put our trust in him. And I'm going to go to the chat now, and we'll see what questions we can answer. Dr. Sankey, do you have anything that you want to add here before I start going to the questions?
Absolutely. So I'll have you do the stop screen sharing, and then that way, when you're answering the questions, we'll have our gallery view for everyone to see one another. So go ahead with the questions, Dr. Sinclair.
So I'm going to start at the top and go down. Why the BRCA gene test is not done on a routine basis? Because it's actually rare. The number of people with it is rare. And so that's why it's not done routine. It's done when you have certain things. If you have multiple family members, if you have young family members, young men in their 40s and 50s, certainly if you have a family member in their 30s or multiple family members, that's when we do it, because it's rare, and the results are going to be few and far between. The next one is are there any other ways that a papilloma that can be detected than when your breast is leaking or when it turns to cancer? Okay, a papilloma can just be a benign tumor, or it can be a harbinger of an early cancer. The person talked about breast leaking. One of the signs that you have a problem is when you have a discharge from your nipple. And if you have a bloody nipple discharge, it should not be ignored. Again, don't panic, but it should not be ignored. And the only way to detect this is to get a sample of the tissue. Sometimes just getting a sample of the bloody drainage is enough to see that there's a papilloma. And then we have to remove it and get the total picture. So there is, that is the way to diagnose this. We can't diagnose it without tissue. And the only way to sometimes we can tell if there's a normal finding on the mammogram or ultrasound, but not without a biopsy or some sort of tissue. Sometimes we can diagnose it just with the leakage from the breast, which is the discharge. And sometimes I actually have to, when you look at the ultrasound, you notice the ducts are dilated. As we get older, our ducts are supposed to get smaller because, of course, it's been years and we're not going to be having any more children. But if it's there, that's something that needs to be done. What are your views on thermogram in place of thermograms? Are a waste of time. People have been pushing them now for decades. They do not help. They do not diagnose breast cancer, and it has been tried and proven to be it just doesn't work. So it's not a matter of my views. Those are the facts. Thermograms don't work. This is something that was researched. It just has not panned out to be an effective way of screening. Does implants increase the risk of breast cancer? Implants themselves do not increase the risk of breast cancer, but they can delay diagnosis. How? Because once you have an implant in your breast, you have pushed the breast tissue aside, and the reading of the mammograms are a little bit more difficult. So yes, you can have, it can cause a delay in diagnosing, but it does not increase your risk. Does radiation or chemotherapy destroy good cells? If so, what can be done to build running cells? Everything we do destroys, even surgery. When I do surgery, I'm taking out good cells as well as the bad, because we have to take it out with a margin. So yes, chemotherapy, radiation therapy, it is going to destroy some good cells. The way to rebuild your cells, again, is what we talked about in the beginning, a healthy lifestyle, which includes what you eat, your exercise pattern, your sleep pattern, water, those sort of things. Those are the things that help you build up back your body. Doctor. Okay. Some thank yous, and I appreciate it. No. Donna, no, you cannot use a sonogram instead of the mammogram. We actually went through that in the early part, and I just noticed, because I'm part of the Society of American Breast Surgeons, the sonogram, they even went through the trouble of developing these really high-powered sonograms. There was a lot of investment both in industry as well as science, and the results are just not great. They're just not as good as the mammogram. And so because they're not as good as the mammogram, ultrasound is more used to define the lesion once it's found. It's used to help us. We do a lot of the biopsies on the ultrasound, but no, it's not a substitute for the mammogram. Can a biopsy cause cancer to spread? No, it does not cause cancer to spread at all. That's something we also studied. This concept of the ear touching the cancer, even with surgery, and then I don't know where it started. I don't know who started it. All I know, it is one of the most pervasive mistruths that is literally worldwide. I get patients who are white, Black, Caribbean, African, American, and they all, I get a handful of patients who always ask me this question about spreading cancer. Biopsies do not spread cancer. Okay, now there's a question here that I'm gonna punt to Dr. Wendy. It said, at what age is a pap smear no longer necessary? Dr. Wendy, come and save me, please. Dr. Perot. I hope she's still here. I see her picture there. I hope she's still there.
Okay. That has gone through.
1 second, Dr. Wendy. Dr. Wendy Perot is an OBGYN.
Okay, I'm here. Are you hearing
No,
me?
I'm just letting the people know, because I don't know if they know who you are.
Okay.
Go ahead. Go ahead, Dr. Wendy.
I have this area of pap smear have gone through back and forth. You know, when do we start it? When we don't start? I can tell you some history about it and tell you how far we have come. When I was in medical school, we started pap smears at age 18. But then we had the smear, you know, the slide that we would take it and smear it on the slide, fix it on the slide, and send it to the lab. And then we came out with a thin prep pap smear, or the liquid-based pap smear. And that was a little bit more accurate. So we're saying now, so presently the new thing is this. Well, let me back up a little bit. We said, okay, we need to start the pap smears when you become sexually active, whatever age that was. Then, so when we came up with the thin prep pap smear, we realized that we were getting a lot of positives, and physicians were going in and doing things and destroying young people's cervixes. So okay, hold back a little bit. Now we start our pap smears at age 21. And when do we, so we continue the pap smears from age 21, we've added HPV in that. And we can do a pap smear they're saying now every 3 years. I don't do that. I do my pap smears I recommend my pap smears on my patients every year. And I do it until age 70. And after age 70, I say, if I have been following this patient and I know this patient, and I would stop doing a pap smear at age 70, but never stop doing a pelvic exam. It's a difference. There's a difference. Pap smear, you put a speculum in, you get a sample. The pelvic exam is where I'm able to feel the uterus and the ovaries and to see if there's any pelvic masses. You need a pelvic exam just as you would need someone listening to your heart on a yearly basis. So while we do, now Medicare says you should stop it at 65. I push my patients to age 70. That's just my personal thing.
So much, Dr. Wendy. Another question that came in is, does onset of your periods have any relationship to developing breast cancer? What happens is, and in the early part of the lecture, we mentioned this a little bit, people with early menarche, which is early onset of period, and late first pregnancy are at increased risk for breast cancer, not ovarian, increased risk for breast cancer. So the time between you first start your period and the time between when you have your first child, we notice that there's a slight increased risk. And remember, these are risks, they're not absolutes. So it's not like saying, oh my goodness, I'm 29, I'm not married, I should go out and have a baby to help prevent having breast cancer. No. You just need to know your risks. And if you're at a higher risk for something, then you know you need to be more vigilant. Okay, let me see. Did we get anyone else?
Is that the last question?
I thought I got them all. Is there anyone, you can use the raise hand feature or just speak if I did not answer. I thought I got all the questions.
I see your hand, Moria. Would you like to open your mic and let's hear your question?
Good evening, everyone. Good evening, Dr. Pero. You have set my brain. Just give me 1 second. Terry, come and get Kyle. You have set my thought patterns this evening in a different way. I have 2 questions to ask. What happens? Why? When someone goes into remission, or you hear that person say that I'm now cancer-free, and maybe 5, 6 years down the road, this cancer would come back with so much aggression, and they really are being saved. So I need to know what happens there. And then why is it when a woman gets older, I can speak for myself, your breasts get very tender, you know, the slightest bounce is not a pain, but it's just tender compared to when you were younger. It could have taken, you know, all the roughness. And I find that as I get older, my breast is very tender, not painful, but tender compared to back then.
Okay, so the first question is about cancer recurrence, and the second is about breast pain, which I'm going to deal with the second question first. I know when something happens to us, we believe that it happens to everybody, but it actually doesn't. There's some people who do get breast pain, and others, it's the opposite. When they were younger, they used to get breast pains, and now that they get older, they don't. Our bodies are forever changing. It could be a variety of things. It could be our estrogens. It could be some of the medicines that we take on a regular basis. It could be our weight. Breast pain is one of the most elusive things, and there are multiple causes. So unless you were like specifically evaluated, I can't address that specifically. Some of the things that we should do when it comes to breast pain is make sure we're wearing the correct size bra. You know, I was looking through some old pictures as I was unpacking, and I was like, you know, I'm not that size anymore. And part of the thing with us as women, our weights change and so on, but we still wearing the same bra we were wearing 10 years ago. We need to make sure, I'm serious, we need to make sure, it sounds simple, but we need to make sure we're wearing the correct, we're being supported properly. Weight gain and other arthritic changes that happen to us can be referred into our breasts. Now, to your first question, the thing about cancer is, you're right. There are some people who are cancer-free and then it comes back. There are several reasons for that. Some people had very aggressive cancers, and yes, they're treated and they're cancer-free for a while, but because of the aggressive nature of the original cancer, it's back. I have several people, young people in their 30s with breast cancer, and I can almost rest assured their cancer is coming back. Because cancer is a disease of older women. So when you are young, and you develop cancer in your 30s, that cancer by nature is aggressive. They tend to be, when we look at our pathology, all the tests we look at, they tend to show a more aggressive cancer. And so for that reason alone, even though they may go through a period of years, the likelihood of it coming back is just there because their body is already prone to, whether it's genetic and everything put together, of getting cancer. But unfortunately, one of the other issues is, Ms. Mariah, is people who do not get fully treated. I have known patients of my own. I have met other people because people know what I do. I've been other places. I've been on vacation and met people, and somebody said, "Oh, talk to this lady. She had breast cancer." And she said, "Well, I did this, but I'm not going to do that because I'm going to try this and I'm going to try that. I'm not going to get this." So yes, they're cancer-free for a while because they've had part of the treatment, which really has just slowed it down. Because they didn't kill the thing, when it comes back with a vengeance. And you're right. Most of them, when it does come back, we still do everything we can at that time. But at that time, we're already, they're already almost overcome. And by God's grace, sometimes they'll have a few more years or months. But that is a primary reason why people don't do well. And especially I've seen it in those who have chosen. And what I do when I have patients is I document. And they'll come back in the office and say, "Well, no." And I was like, "I have it right here. On this visit, we talked about you're getting the rest of your treatment." And they said, "No." Some people have told me point blank, and it has nothing to do with education. It has nothing to do with their insurance. It has to do with their thought process. They said, "You said you got the whole treatment." I said, "Yes, I did my job, but it's not your whole treatment." And many of the patients that I have encountered, patients as well as personal people that I know, this is exactly what happened. They were only partially treated because they didn't want to go through the rest of it. And they felt well after surgery, or after, sometimes they had radiation but not chemo, or chemo not radiation. And so they think everything is fine. Well, as you continue to monitor them, it comes back. And you're right, it's always more aggressive. Cancer is like a serial killer torturer. You don't play with them. Once you get them, you need to kill them. You can't say, "Oh, I'm going to rehab them for a couple of years and put them in jail and then they're going to come back out." No. And that's the way we have to look at cancer. It's not the same. Somebody had just asked about Underwire Bra. No, it has nothing to do with that. Whether or not you wear Underwire Bra is for your comfort. And Dr. Wendy, there's someone in the chat who wants to know how they can get in contact with your office. I don't know if you can put something there. I think they're just excited to see a young OBGYN and didn't know you were in the area. But I just saw it there, so I'm putting it out there. Get in contact with your office. Anyone else have a question?
Any other questions? Dr. Sinclair, this has been amazing. This has been so informative. We can never talk enough about how do we care for our breasts. Even though it's a, once a year Breast Cancer Awareness Month, every single month, every single day is Breast Cancer Awareness Day and month. We should be looking in the mirror to see if we see any changes. We should be checking ourselves every month. And so do not wait till once a year to just do those checks. And also, get your mammograms. That's really important. And if you're having difficulty, there are many organizations out there that Dr. Sinclair shared with us that you can get a mammogram at a discounted rate. Sometimes there's grants, sometimes there's money out there that people are just wanting to give away because they believe the importance of getting a mammogram. So please do not let that be a barrier to you getting your mammogram. This is a great time to get it. If you've already had it, my suggestion after today is tell a friend, tell a family member, please get checked, because it's easy to prevent it than to actually try to treat it. And we know an ounce of prevention is worth a pound of cure. So I want to thank you so much on behalf of health.
Let me just say really quickly, Dr. Sankey, most hospitals, including Advent Health and ORMC, and are given, they will do routine mammograms at a flat rate discounted prices for uninsured patients during the month of October.
Okay.
So if you're a part of that category, you know someone's part of that category, please know that most of these facilities are like giving like a flat rate mammogram during the month of October.
Wow, that's great. Thank you for sharing that. Thank you for sharing that. We want people to have that information so that they will take the best care of their health. We know that when Jesus came, he said, I want you to live life more abundantly. And the way we live my life more abundantly is actually to prevent things, not allow it to happen if we can, if it's within our power. Well, on behalf of Living Well and Mount Olive Health Ministries Department, we want to say thank you for joining us today. We're on this platform every single Sabbath at 4:30, and we have various topics that we're talking about. Our next week, our goal is actually to have a testimonial from an individual who had breast cancer. And sometimes you hear firsthand from them of what the steps they went through can really help you to see how, if you're going through that now, how you can also make it through. Thank you again. We're going to actually pause and we're going to pray and just thank you for joining us again. Emmeline, before I get off the set, anything that you want to share with our audience? Emmeline?
No, I do not have anything else to share. The person who asked for Dr. Perot's information, I can give it to them. I didn't see her put anything in the chat. I'm sure it's okay, Dr. Perot, right? If I spread the good news.
Great. Okay.
It's okay. You could go ahead. It's okay.
Yeah. So you can get with me. Yeah.
Absolutely. So we want to close out in prayer. Many times we'll ask if there's any prayer requests. Do we have any prayer requests today? I'm going to stop the recording.